A pleasant day everyone, I am Miley Nahulan. I am here to present to you my final requirements and teaching strategies. Unsafe medication practice and medication errors are a leading cause of injury and unavoidable harm in a healthcare system across the world. WHO has identified medication without harm are the theme for the third Global Patient Safety Challenge. Overall goal is to reduce the level of severe avoidable harm leads to medication error by 50% over 5 years globally. So error can be preventable, error can be avoidable. We are talking about the basic medication safety. My learning objectives are: number 1, recognize the importance of checking medication labels and packaging. Number 2, identify and familiarize LASA medication and high alert medication that can cause potential serious harm if used incorrect. Number 3, implement additional safety measures concerning storage, handling LASA and high alert medication that are vulnerable in medication error. Number 4, understand the importance of 10 rights of medication administration. Number 5, describe common adverse drug reaction and understand the importance of reporting and documenting medication error. Number 6, develop effective communication skills. Educate patients about their medication, including dosage, frequency, and potential side effects. Why medication safety is important? The safety is an essential part of patient safety. Harmful unintended reaction to medicines are among the leading causes of death in many countries. 44,000 to 98,000 people in US die annually as the result of medication error. 19% of all medical errors are medication related, and only 1 to 10% of medication errors are voluntarily reported. Medication errors reported do not reflect patients' harm, and every day, more than 4,000 people have adverse drug reactions, so serious that they need to be admitted to hospital. In addition, every day, about 2,000 hospitalized patients suffer from adverse drug reaction. About 50% of these adverse drug reactions are preventable. Medication error can affect patient safety through 3 dimensions of quality care: patient safety, clinical effectiveness, and patient experience. So the reducing of medication errors is an important priority worldwide. Medication issue can affect and impact patient outcomes, length of stay in the health facilities, and readmission rate and over cost of healthcare system. To increase the knowledge and go deeply into the medication safety, it is necessary for us to go through some definition. The most important definition are: number 1 is the medication error. The National Coordinating Council for Medication Error Reporting and Prevention, or the CCMERP, defines medication error as any preventable event that may cause or lead to inappropriate medication use or patient harm, while the medication is in the control of the healthcare professional, patient, or consumer. Another definition of the medication error is a failure in the treatment process that lead to or has the potential to lead to the harm of the patient. Let's go to number 2, adverse drug event. Adverse drug event is an injury from a drug-related intervention and can include adverse drug reaction and can result from errors in prescribing, dispensing, and administration. Number 3 is the adverse drug reaction. Adverse drug reaction is a response to a medical product which is nauseous and unintended, and which occurs at the doses normally used for prophylaxis, diagnosis, or therapy of the disease, or for restoration, correction, or modification of physiological function. Number 4 is a near miss, an event, situation, or the error that took place but was captured before reaching the patient. For example of this, the wrong drug was dispensed by the pharmacy, and the nurse caught the error before it was administered to the patient. Number 5 definition is the hazardous situation. Hazardous situation refers to the circumstances or event that have the capacity to cause error. Example given is the confusion over LASA, drugs, or a similar packaging. Number 6 is the defective medicines. Defective medicine, it is the medicines where the product presentation and the quality are not in the accordance with the regulation and the professional standard. ADE or adverse drug event versus medication error. Medication error are common than adverse drug event, but result in harm less than 1% of the time. About 25% of adverse drug events are due to medication error. This is an important concept as then concept of adverse drug event and medication errors overlaps but are not interchangeable. While all adverse drug reaction is adverse drug event, but not all adverse event are adverse reaction. For example, a patient giving a drug medication is an adverse event, but not adverse reaction, because the medication inclusion was not used as it was intended. These figures helps to clarify how the medication error differ and relate to one another. Medication error may be related to professional practice, healthcare product, procedures and system, including prescribing order, communication, product labeling, packaging, and nomenclature, compounding, dispensing, distribution, administration, education, monitoring, and use. Errors are committed by both experienced and inexperienced staff. Classification of medication error. For more understanding of the nature of error, we should consider the human error. Human error is unintentional action or decision. Violation or intentional failure. There are 3 types of human error: the skill-based error, slips and lapses, and mistakes. This kind of human error can happen to even the most experienced and well-trained person. Mistakes may be defined as errors in the planning of an action, and the knowledge-based error. The rule of this error can further be classified as either application of good rule or application or a bad rule, or failure to apply a good rule. Medication error can occur in many steps in the patient care, from the board of ordering of the medication to the time when the patient is administering the drug. Prescribing, ordering with 51%, transcribing, verifying with 26%, dispensing, delivering with 7%, administering 5%, monitoring and reporting 1%. In general, medication error usually occur in one of these stages. Medication error are the most common at ordering or prescribing stage. Typical error includes the healthcare providing writing, route of administration, dosage, and frequency. This ordering error accounts for most 50% of the medication error. Data show that nurses at the pharmacy identify anywhere from 30 to 70% of medication ordering errors. Categorizing medication errors. Usually, medication error are detected only if they have clinical consequences, requested by the patient, such as the presence of symptoms, sometimes up to the administration of medication. First, the healthcare professionals are alerting for it. Medication error identified were classified according to the seriousness type at pharmacological class. Seriousness was categorized using 9 different categories, from A to I. The classification includes occurrence of an error, if error reaches the patient and not having harm, the harm associated with the error, and the necessary measures. The classification was based on National Coordinating Council for Medication. The NCCMERP adopted a medication error index that classified an error according to severity or the outcomes. The index considered facts such as within the error reached the patient and if the patient was harmed or on what degree. The NCCP-MERP definition of medication error and risk assessment index. Category A, no error circumstances or event that have capacity to cause error. Category B is an error but no harm. An error occurred but the medication did not reach the patient. Category C is an error but no harm. An error occurred that reached the patient but did not cause harm for the patient. Category D, it is also an error but no harm. An error occurred that resulted in the need for increased the patient monitoring but not harm the patient or required intervention to preclude harm. Category E is an error or harm. An error occurred that resulted in the need for treatment and intervention and caused temporarily patient harm. Category F is an error and harm. An error occurred that resulted in initial or prolonged hospitalization and caused temporarily patient harm. Category G is an error and harm. An error occurred that resulted in permanent harm. Category H is the error and harm. An error occurred that resulted in a near-death event, anaphylaxis, or cardiac arrest. Category I is an error and it is death. An error occurred that is resulted in patient death. If the medication error happens, the patient's safety and well-being are your first priority. Stop the error, monitor the patient closely, notify provider, supervisor, and also physician as soon as possible. Don't forget to report the medication error. Reporting medication error does not mean there is a blame or harm, only to improve healthcare and to highly improve safety and quality medication use to patient. Also to learn from our mistakes to prevent recurrence. Factors may influence medication error. Number 1, factors associated with patient information. The lack of accuracy of patient record or information, unknown patient drug history or clinical information, age, weight, allergies, laboratory result, it will cause medication error. Having essential patient information at the time of medication, prescribing, dispensing, and administration will result in a significant decrease in preventable adverse drug event. Number 2 is the factors associated with medication. 35% of preventable adverse drug event attributed to inadequate direction of drug information, insufficient knowledge of drug dosage or miscalculation or incorrect measurement of a drug concentration, incomplete labeling during the storage that we take care, the look alike and the sounds alike, about the condition of the storage, the name of medication, for example, and also failure to use the standard protocol. Handwriting medication administration, essential drug information is ready available and multiple forms to those ordering, dispensing, and administering medication. Factors associated with the healthcare professionals. As a staff and healthcare professional, adequate communication is needed. Miscommunication between pharmacists and nurses is a common cause of medication error. To minimize the amount of medication error caused by miscommunication, it is always important to verify drug information and eliminate communication barriers. Number 4 is the factors associated with work environment. as noisy, physical work as poor lighting while undertaking the drug rounds or drug administration to patient, ventilation, temperature, and also disorganized storage. Number 5 is the factors associated with patient: personality, literacy, language barriers, and also complexity of clinical cases, including multiple health conditions, polypharmacies, and high-risk medication. Eliminating error-prone abbreviation symbols and dose designation. The abbreviation symbols and designation found in this table had been reported as being frequently misinterpreted and involved in harmful medication errors. They should have never been used when communicating medication information. Hospital healthcare staffs are not allowed to use prohibited abbreviation when documenting in medical record form. Avoid trailing zeros, example, write 1, not 1.0. Use leading zeros, write 0.1, not 0.1. No accepted terminology and write neatly, print if necessary. High alert medication. It is showing in my screen the updated list of high alert medication. It is the medication that bear a heightened risk of causing significant patient harm when they are used in error. During preparation, dispensing of high alert medication, do not miss the following. Number 1. Reject the incomplete prescription. Patient names, name of the drug, rate, route of medication, patient record number. Number 2. Independent double checking during preparation, dispensing, and administration. Number 4. Using auxiliary red label or red sticker. And number 5. Chemotherapy drugs, TPN, narcotic shall not be accepted by using verbal and telephone order. And also, not accepted any prohibited abbreviation. Strategies to avoid errors involving high alert medication. All high alert medication vials or ampules must be labeled as high alert medication. All personnel should read the high alert medication labels carefully before storing to ensure medication are kept at the correct place. All high alert medication should be kept in individual labeled containers. Whenever possible, avoid sounds alike and look alike drug or different strength of the same drug being stored side by side. Use Tolman lettering to emphasize differences in the medication name. Example given is dopamine and dobutamine. Strategies to avoid errors involving high alert medication during prescribing, preparation, dispensing, and administration stages. First of all, we have high alert medication list and it is updated annually. Independent double checking, not use prohibited abbreviation, use red label, standardized concentration of IV, we have IV manual, we have crash cart diluent guidelines, not allowed telephone order when prescribing order, stored in separated locked single cabinet with limited quantity, sign and countersign by 2 nurses during administration of high alert medication. Medication safety risks with insulin. Insulin is considered high alert medication and look alike sounds alike. It is a life-saving but life-threatening. Represents 16.2% of all harmful medication errors reports. Insulin medication errors occur in hospital settings and during each steps of medication use process. In prescribing and transcribing abbreviation, not U instead of unit, not CC instead of ml. Illegible handwriting, missing or unplaced zeros, and decimal points. Insulin as a high alert medication. Storage and dispensing. All insulin infusions should be prepared in pharmacy. Standardized insulin infusion concentration in hospital-wide. Pharmacies should be prepared and dispense pre-filled syringe for long-acting insulin with high alert label. Use Tolman lettering. Insulin vial should be labeled with the patient's name and vial expiration time per institutional guideline. In administration of insulin, independent double-check system limit types of syringes in patient's care area, tuberculin versus insulin. Insulin infusion should be administered by smart pump technology. Pre-printed guides to appropriate setting of IV pumps. Monitoring, coordinate, and standardize meal blood glucose testing in insulin administration. Alert staff when diabetic patient when insulin order have their feeding held or discontinued. Educate family caregivers to request mealtime for insulin. Look-alike and sounds-alike involves medication that is visually similar in physical appearance or packaging, or names of medication that have spelling similarity or similar phonetics. These confusing similar names, product, packaging are one of the main causes of medication error that may lead to potentially harm the patient. Look-alike medication, drugs with similar names or packaging that can add confusion and leads to error. Example for this is dextrose 5% and dextrose 50%, ampicillin and amoxicillin, novolog and novolin, injection phenylephrine hydrochloride, and injection neostigmine methyl sulfate, levocetirizine 5 mg, and levothyroxine 50 mg. These are the newly updated list of look-alike and sounds-alike. Staff should know the location of LASA list and which is the drug look-alike and sounds-alike with which drug. What does it mean Tolman lettering? Why Tolman lettering? Tolman lettering involves highlighting similar letter in two names to aid distinguish between the two. The Institute of Safe Medication Practices, IMP, U.S. Food and Drug Administration, the Joint Commission, and the other Safety Council organization had promoted the use of Tolman. It's a one way of reducing confusion of similar names. Use Tolman lettering to emphasize the medication of sounds-alike names. Tolman lettering is the practice writing the part of medicine's name in uppercase letter to help distinguish medicines with sounds-alike medication to another to avoid medication error. Example, metformin, metronidazole, nimodipine, and nifedipine. Warning labels for LASA is showing in the screen. Warning labels on storage bin, medication trolley, or emergency trolley that can be used. Look-alike medication. Names of medication which due to their spelling may look similar to other medication names, and distribution or administration of this medication may be prone to errors. Also refer to product labelings and packaging. Example for this is Prozac and Proscar. For sounds-alike medications, name of medication which due to their pronunciation may sound similar to other medications' name, and the distribution or administration of these medications may be prone to errors. Example, ceftazidime and ceftizocine. Look-alike, sounds-alike medications accounts for estimated 25 to 30% of medications error. With tens of thousands of medications currently on the market, the potentials for serious error due to confusing medications names is significant. Recommendation for preventing drug name mix-ups. Maintain awareness of LASA drug names, clearly specify dosage form, drug strength, and complete direction on prescription. Include the purpose indication of the medication in the prescription. Alert patient for potential mix-ups. Encourage patient to ask nurses or pharmacists about unfamiliar medication they may be given. Avoid verbal orders. If used, require staff receiving order to read back the order. Example of look-alike medication are ondansetron and ranitidine. Another one is a paracetamol 500 mg suppository and Discodil 10 mg suppository. Nurses are primarily involved in administration of medication across various settings. Medication administration error shows medication error rate 10 to 15%, mainly in the form of wrong time, wrong rate, and wrong dosage. There are many ways to prevent medication error, and one way of which is understanding in the 10 rights of medication administration. Understanding the 10 rights drug administration can prevent many medication errors. Nurses who are primarily involved in administration benefit from this simplified memory to help guide them to administer medication safely. Here are the 10 rights of medication administration. Number 1 is a right medication. Check the name of medication, brand name should be avoided. Check the expiry date, check the prescription, especially antibiotic are reviewed regularly. Check 3 times when you will remove from the shelf and drawer, when you will open the packaging, and once more when you will prepare to administer it to patient. Check medication label. Check and verify if it's the right name and dosage form. Be aware for a look-alike and sounds-alike medication name. Misreading medication name that looks similar is a common mistake. Follow LASA medication error preventing strategies. Check the order and check the allergies. Number 2 is a right dosage. Check the order, confirm the appropriateness of the dose using a drug reference. 2 nurses will calculate the dose of medication to be administered to the patient by following the standard formula for calculation, and recheck the unit dose of medication name and dose while preparing medication. Number 3 is a right patient. Check the name on the order and the patient. Use the full name and patient number. Ask patient to identify himself or herself. Number 4 is a right time. Double check that you are giving the prescription at the correct time. Confirm when the last dose was given. Give a stop order as soon as possible within 30 minutes. Administer drug at a specific time to ensure accurate peak, drop, and syrup level. All antibiotic medication administration will follow the guideline to standardize antibiotic medication dosing time in order to unify antibiotic medication administration. Number 5 is a right frequency. Check the frequency of the ordered medication. Double check that you are giving the correct time. Confirm when the last dose was given. Number 6 is a right route. Check the order and appropriateness of the route ordered. Confirm that the patient can take and receive the medication by the ordered route. Independent double check for the high alert medication prior to administration and should be countersigned by 2 nurses. Number 7 is a right documentation. Document on administration record time of medication if it's given. Sign using initial or signature. Ensure that you have signed for the medication after it has been administered. Ensure that the medication is prescribed correctly with a start and end date if appropriate. Independent double check for the high alert medication prior to administration and should be countersigned by another staff. Any adverse drug reaction should be reported to physician and have adverse drug reaction assessment and reassessment. Document the effect of drug if appropriate. Number 7 is right of education. Check if the patient understands what the medication is for. Make them aware they should contact the healthcare professional if they experience side effect or reaction. Provide enough knowledge to the patient if what drug she is taking and what is the expected therapeutic side effect. Number 9 is monitoring or right assessment. Ensure medication is working the way it should. Ensure medication are reviewed regularly. Ongoing observation if required. Monitor side effect for all drugs administered. Number 10 is right to refuse. Ensure you have the patient consent to administer medication. Be aware that the patient do have a right to refuse refuse medication if they have capacity to do so. Respect patient decision of refusing any medication. Inform the treating team or on-call for the proper explanation for possible complication and effect and document it in nurse's note. Message about medication error. Medication error may or may not reach the patient. It is usually preventable. It is usually unintentional. May or may not cause harm. A medication error that causes death called sentinel event by the Joint Commission. When sentinel event occurs, the institution is required to perform root cause analysis. Thank you so much for your time listening about the medication safety and strategies, how to prevent and minimize medication error. I hope this encounter has been fruitful and informative. Keep safe everyone, and God bless you all.